Hey guys, I am here to discuss our clinic case, which we have been uploaded. Atrial septal defect, symptoms, and pathophysiology. What is ASD? An atrial septal defect is a congenital heart defect in which there is an abnormal opening in the interatrial septum, allowing blood to flow between the left and right atria. Types of atrial septal defect. ASDs are classified according to the location of the defect in the atrial septum. 1. Ostium secundum atrial septal defect. Most common type. Location. Middle part of the atrial septum at the region of the fossa ovalis. Associations. Usually isolated defect, often suitable for device closure. Mnemonic. Secundum equals septum center. 2. Ostium primum atrial septal defect. Location. Lower part of the atrial septum, near a V valves. Associations. Mitral valve cleft. Tricuspid valve abnormalities, common in Down syndrome patients, part of atrioventricular septal defects. 3. Sinus venosus atrial septal defect. Location, upper posterior septum, near entry of the superior vena cava, and association, partial anomalous pulmonary venous return. This is a favorite exam question. 4. Coronary sinus atrial septal defect. Location, near the coronary sinus. Cause, unroofing of the coronary sinus. Frequency, very rare. Easy mnemonic, SPSC. S equals secundum, P equals primum, S equals sinus venosus, C equals coronary sinus. Exam Pearl. If a question mentions fixed wide splitting of S2 and an ASD, think ostium secundum ASD first, because it is the most common type. Now remember previous case symptoms: shortness of breath, easy fatigability, recurrent respiratory tract infection, poor weight gain, tired faster.
Now, pathophysiology, which is easy to understand. Step 1, pressure difference. Left atrial pressure is normally higher than the right atrial pressure, so blood therefore moves from the left atrium towards the right atrium. Step 2, left-right shunt. Oxygenated blood that should go to the body is redirected back to the right side of the heart. Step 3, right heart volume overload. More blood enters right atrium, then it goes to the right ventricle, then pulmonary circulation. This causes right atrium and right ventricular dilation and increased pulmonary blood flow. Now step 4, long-term effects. If untreated, pulmonary hypertension develops, right heart failure may occur, atrial arrhythmia, especially the atrial fibrillation because atrium becomes dilated, then rarely shunt reverse. When shunt reverse, it becomes right to left, causing cyanosis, and this is known as